name is Kelsey. I'm going to be your nurse today. What do you prefer to go by?
Reese.
Okay, Reese. We're going to go ahead and do a lengthy physical assessment. It's going to take about 50 minutes. Do you need to empty your bladder first?
No.
Okay. So, when I saw you walk in the room, your mobility was good, your gait was steady, your general appearance, your seated upright on the exam table, behavior is appropriate, dress is appropriate with good hygiene, all your body structures appear to be symmetric here. Next, I would go ahead and get your vital signs, your temperature, your blood pressure, heart rate, and respiratory rate. Now I'm just going to ask you a few questions. So, do you know where you are right now?
Doctor's office.
And what's your name, date of birth?
December 12th, 1994.
Your name?
Reese.
Okay. And then what month and year is it?
May 2025.
Okay, good job. And I have to ask you a abstract reasoning question, abstract thinking question. What would you do if you saw blue lights flash behind you?
I would pull over.
Okay, good. So speech is clear and concise, judgment is intact, and patient is alert and oriented ×3. Next, I'm going to go ahead and just look at your facial structures here. They all appear to be symmetric, no drooping or abnormalities or obvious protrusions. The hair appears to be clean and evenly dispersed over the scalp. No infestations, no dryness or flaking, smooth. Next, I'm going to go ahead and feel. Let me know if there's any pain or tenderness. Any pain or tenderness?
No.
Okay. No pain or tenderness present there. On the scalp, there was no obvious deformities, no sutures felt, and no nodules. And scalp was symmetric and round. Next, we're going to go ahead and look at your eyes here. So I'm going to have you close your eyes for me and look at your external eye structures. Your lids close over your eyes are symmetric. There's no drooping. The eyelashes are pointed upwards and out, and they're all evenly distributed on the lid. Have you open your eye for me? The sclera are white and clear. I'm going to pull up here on your eye and then down. Okay, so the conjunctiva is pink and there's no signs of obvious drainage. Next, we're going to hold this Rosenbaum card 12 inches from your face. You're going to cover one of your eyes. Read the lowest line you can see there.
LTFPH.
Okay, and then do the same with the other eye.
LTFPH.
Okay, and then both eyes open.
LTFPH.
Okay, so the vision's 20/20. Near vision is intact there. Next, I'm going to use my little pen light here. We're going to look at your pupils. Okay, and they're about a 3 here. Have you look at my nose and then look at the wall. My nose and then the wall. Pupils were a perla. They were equal and reacted to light, and accommodation was also intact and present. Near vision was intact, and eyes appear to be the same, equal bilaterally. Next, we're going to use this ophthalmoscope here. And I'm just going to look for your red light reflex. So right eye to right eye. Okay. And left eye to left eye. Okay. Red light reflex is present and equal bilaterally. Next, we're going to move on to the nose. The nose appears to be symmetric. The septum appears to be midline, and the turbinates appear to be patent. There's some fine hairs present. The mucosa is pink and intact. I'm going to have you do the sniff test for me. So close one nostril and sniff, and then the other one and sniff. Okay, so the nasal passages appear to be patent there. Next, we're going to move on to the ears. So I'm going to look at your external ear structures. I'm going to be feeling around, so let me know if there's any pain or tenderness with this. There's no warmth, no redness, any pain or tenderness.
No.
No pain or tenderness of the pinna, the tragus, and the mastoid. Next, we're going to go ahead and move on. I'm going to look at your internal ear structures with my otoscope. All right. So for an adult here, I'm going to pull up and back. Okay. So the internal ear canal was pink and looked to be intact. There was just some fine hairs and cerumen present. The tympanic membrane was pearly white, cone of light was present. Do the same here on the other side. Okay. So the internal ear structures, the internal ear was pink. The mucosa appeared to be pink as well, with some fine hairs and cerumen present. The tympanic membrane was a pearly white, and the cone of light reflex was present. Next, I'm going to go ahead and feel your sinuses here. Let me know if there's any pain or tenderness. Frontal, maxillary, any pain or tenderness?
No.
Okay, no pain or tenderness, no palpable nodules felt on the sinuses. Next, we're going to go ahead and look at your mouth. So your lips appear to be midline. There's no drooping. They're pink and intact. I'm going to have you smile for me. Okay, so the teeth are all intact, and there's no missing teeth or apparent dental issues just by inspection. Next, I'm going to have you smile for me again. Look at your gums. Gums are pink, moist, and intact. Open your mouth for me. The tongue appears to be midline and rough and pink. No lesions present. Next, I'm going to have you kind of stick your tongue out for me. Say ah.
Ah.
Okay, so the uvula, rose and fell phonation was present in pink. The hard and soft palate were visible. They were pink and without lesions. And then the pharynx was also pink without lesions and moist. All of them appeared to be intact and symmetric. All right, next we're going to move on to your neck here. So your neck appears to be midline. I'm just going to feel for your carotids. 2+. 2+. Carotid pulses are 2+ equal bilaterally. And then I'm going to go ahead and listen for bruits with the bell of my stethoscope. Okay, there's no bruits heard with that. Next, I'm going to go ahead and feel for tracheal deviation here. Trachea appears to be midline with no deviations. I'm going to have you drink this cup of water here. I'm going to feel your thyroid for any nodules. Thyroid doesn't appear to be enlarged. Doesn't appear to be a goiter present. Patient was able to swallow. No nodules felt there. Next, I'm going to go ahead and have you turn around on the exam table for me. I'm going to look at your back. Alright, so first I'm just going to look here and inspect. I'm going to feel your spinous processes and your paravertebral muscles. They all appear to be intact. No obvious protrusions here. There's normal curvature of the spine. The skin appears to be intact. It is smooth and warm without lesions present. Next, I'm going to look at your AP diameter. It appears to be 1 to 2, which is normal. And then I'm going to go ahead and listen to 10 different areas here. I'm going to have you breathe in through your nose and out through your mouth for me. Take some good deep breaths. All lung sounds are present, clear and equal bilaterally. Next, I'm going to go ahead and move on to, I'm just going to be tapping my fingers like this on your back. Let me know if there's any pain with this. So all areas were resonant to percussion. And next, I'm going to go ahead and look for your thoracic expansion. Take a deep breath in for me and out. Thoracic expansion was equal bilaterally. Next, I'm going to assess for CVA tenderness. So I'm kind of be hitting my hand kind of with my fist. Let me know if there's any pain for this. Any pain? No CVA tenderness noted. Alright, now I'm going to go ahead and look at your respirations. They are smooth, equal, rhythmic, and labored. Now I'm going to have you go ahead and face the front for me once again. Alright, so I'm going to go ahead and just look at your anterior chest here. Look for any lifts. Feel for any heaves or thrills. Doesn't feel, the chest appears to be warm and intact and symmetric, with no obvious lesions here or deviations. Breathing appears to be rhythmic, regular, smooth. Next, I'm going to feel for your PMI, which is your fifth intercostal space, mid-clavicular line. All right, I was able to feel your PMI there. Now I'm going to listen to 8 different areas in the front of your chest. Have you breathe in through your nose and out through your mouth for me again, using the diaphragm, my stethoscope. Okay, all breath sounds were clear, equal, bilaterally. Didn't appear to be labored. Now I'm going to go ahead and just listen to your different heart sounds here, and I'll name them as I go. The diaphragm, my stethoscope. I'm going to listen to your second intercostal space on the right side, sternal border for your aortic. And then your second intercostal space on the left side, sternal border for your pulmonic. Then the third intercostal space, sternal border on the left side, your Erb's point. Okay, and then your fourth intercostal space, left sternal border for your tricuspid. All right, and then I'm going to go ahead and listen to your fifth intercostal space, mid-clavicular line for your mitral. And here I'm just going to listen for a full minute. All right, and I'm going to go ahead and use the bell of my stethoscope to listen to all the same heart areas. All right, so S1 and S2 sounds are present in all areas. Heart sounds are smooth and rhythmic. There's no murmurs heard or extra presence of heart sounds, I guess, through your S4. Next, I'm going to go ahead and have you lay back for me on the table. Look at your abdomen here. So first I'm just going to inspect. I'm going to look for any pulsations or extra movements here. So the abdomen has a smooth contour, appears to be symmetric bilaterally. There's no bruising or abnormalities noted here, no skin lesions. Next, I'm going to go ahead and listen to your abdominal quadrants here. All 4 quadrants with the diaphragm. And I'm going to make sure you have your legs, there you go, bent for me. Okay, bowel sounds are normal active. They're present in all 4 quadrants. Next, I'm just going to go ahead and do some light palpation of your abdomen. Let me know if there's any pain or tenderness with this. Or I'm sorry, I'm going to percuss first. Let me know if there's any pain or tenderness with my percussion. Okay, all 4 areas are tympanic to percussion. Now I'm going to feel light palpation. Let me know if you have any pain. Pain?
No.
Okay. No pain with that? No pain to light palpation. I'm going to feel a little bit deeper to feel for the presence of any masses. Let me know if you have pain with this. Any pain?
No.
No pain or tenderness noted with deep palpation, and there were no masses felt. All structures appeared to be equal, symmetric bilaterally. Now I'm going to go ahead and feel for your liver border. Liver border was not palpable, or I didn't hear any dullness to percussion with that. I'm going to feel for any aortic pulsation. I don't feel any type of aortic pulsation present here. I'm going to feel your femoral pulses. All right, and they are a 2+ equal bilaterally in your femoral pulses. Next, I'm going to assess for the presence of a hernia. Can you kind of just raise your head for me? The table? Okay. So there doesn't appear to be any, you can lower it. There doesn't appear to be any hernia present. Now I'm going to go ahead and do rebound tenderness. So I'm going to press down and let me know if there's any pain when I take my hand off. Any pain?
No.
Okay. So no rebound tenderness present. You can go ahead and sit for me on the exam table now. All right, so now we're just going to go ahead and feel your lymph nodes in your face. So pre-auricular, post-auricular, occipital, tonsillar, mandibular, submental, inferior cervical chain, deep chain, cervical chain, and superficial cervical. And then I have you kind of raise your arms for me. All right, so supraclavicular. Any pain with any of that?
No.
Okay, so no pain and no palpable lymph nodes or nodules felt. Now we're going to feel the lymph nodes here in your upper extremities. So lateral, central, pectoral, subscapular, infraclavicular. We're going to do the same on this side. Lateral, central, pectoral, substernal, and then infraclavicular. Any pain or tenderness with that?
No.
No pain or tenderness in any of the lymph nodes, and there were none felt and no palpable nodules. Now we're going to go ahead and just look at your upper extremities here. Okay, there's no lesions, edema noted. They appear to be symmetric. I'm going to go ahead and feel upper extremities. Feel warm and dry. Skin is smooth. There's no joint deformities here that are obvious. Now I'm going to go ahead and feel for your brachials. Brachial pulses. They're 2+ equal bilaterally. Your radial. 2+ equal bilaterally. I'm going to look for your cap refill here. All your fingers. Alright, and it's less than 2 seconds. Your nail angle is 160 degrees, which is normal. I'm going to look for skin tinting or turgor. There's no skin tinting or turgor present. Now I'm going to look at your neck again. Have you turn to the side. Look for any type of JVD or jugular venous distension. There was none present. Next, I'm going to go ahead and look at your lower extremities here. I'm just going to inspect them. Doesn't appear to be any lesions or abnormalities. The joints appear to be symmetric. I'm just going to feel for warmth. Any tenderness with this?
No.
No pain or tenderness. They're smooth and equal bilaterally. There doesn't appear to be any edema or varicosities. I'm going to check over your bony prominences for edema. No edema was felt here. So for the posterior tibialis, I'm just going to feel your pulses. They're 2+ equal bilaterally, and then your pedal pulses, 2+ equal bilaterally. I'm going to test the cap refill here in your toes. All right, so it's less than 2 seconds equal bilaterally, and your nail angle is 160 degrees. So now I would, if you were a female, I would do a breast exam. So I would compare size and symmetry bilaterally. I would assess dimpling in 3 locations. Look for any abnormalities with your hands down at your sides, hands on your hips, and then hands overhead. Then I would have the patient lay flat on the table with their arm raised at the side I was palpating, with a pillow underneath their scapula. I'd feel all the breast quadrants. I'd feel for the tail of Spence and the nipple. I'd look for any type of discharge, masses, or lumps. And I would feel. I would also teach the patient how to do a self breast exam, when and how, monthly, after their period, in the shower or in front of a mirror. And then with a male patient, I would do a male genitalia exam. I would look for hair distribution and for any masses or swelling. I'd palpate the penis and the testicles, and I would feel for the epididymis and the vas deferens in both of the testicles. I would teach the patient how to do a testicular self-exam. I'd demonstrate the technique for that as well. And I would tell them that they need to do it monthly in the shower and then in front of a mirror. I'm just going to go ahead and look here to make sure I didn't miss anything. All right, and I think the only thing we forgot was the whisper test. So I'm going to go ahead and have you cover one of your ears for me. I'm going to whisper 3 words here and just repeat them back to me.
Table, wall, floor.
Okay, and then the other side.
Basketball, baseball, football.
Okay, so then hearing test, the hearing was intact with that. And I think that was everything here. Thank you again for participating.